course. Medicare does not cover mental diseases. Did I understand that correctly?
Oh, I think they do. Many of my patients are on Medicare, and yeah, you can get psychiatry coverage if you require hospitalization for mental health.
It's probably limited, though. I suspect.
Sure. It's that underinsured group. Mental health coverage in this country is not as good as medical coverage.
They have a great program in this country for the mentally ill. You put them in jail. It's only $80 a day versus $600 a day in a mental hospital.
Well, the mental hospitals are few and far between anymore.
Well, that's it. They closed them all, then they just add it onto the jails. But if somebody's mentally ill, will probably commit some sort of a crime in the pokey, and that takes care of that.
Well, I guess my question is, if you do have a mental illness, lots of times if you can be treated by counseling and so forth, and of course pills sometimes help, but if Medicare doesn't pay for that, what would a senior who...
We're getting an awful lot of static.
Static, yeah, I hear it too.
I think they're trying to tell you you're off the air here.
Okay.
Thanks for calling, caller.
Anyway, maybe you could answer my question about what
Okay.
Is there an alternative for a person that would have something wrong and need help?
Is there an alternative for somebody who's nuts besides, I don't know?
Well, your primary care physician probably treats 80% of the mental illness in this country. Primary care physicians are treating depression, anxiety, but if patients have severe mental illness or if you have problems that you can't treat, they do fall under the specialists, and it's covered. Of course, there's going to be some out-of-pocket costs and some limitations, but people on Medicare have some mental health coverage. But I would say 80%, probably 80% of the mental health coverage treatments provided by primary care physicians in this country.
Okay. The Medicare has a limit of, I think it's 120 days in a hospital, nursing home. Of course, if you get sick again, you get another 120 days. So you just go off the hospital and they bring them back, and there you go. There are ways around all these stupid things.
Yeah, it could be. Yeah, Medicare is not perfect. It could be. It really should be simplified.
Medicare does cover 1,000,000 people. It's the largest senior program, most expensive per capita in the world. And it doesn't provide three interesting things, though. That is eyeglasses. Now, seniors all need eyeglasses. Hearing aids. I need one now. Can't afford it. Well, I could go online and get a little bug for $30, They say it works fine. You tune it up and down. It's the batteries that cost the money. But in the meantime, they also don't provide for dental work. And I've always liked to point out that's because Congress is hoping the seniors will be blind and be deaf and keep their mouths shut. But it doesn't work. The seniors are a very vocal group.
They do vote.
And they do vote. They're the largest block of voters, and every single day I got one this morning when I woke up in my computer, a reminder of how we're being screwed by the Congress, who is giving themselves huge monies and payoffs and raises and so forth, and they're not giving us a cost of living COLA, even the COLA which was promised, so we are starving to death. Seniors are going to be living in their children's cellar eating this, cat food, like they did during the Depression, Rudy. Yeah, and the Congress is laughing all the way to the bank. They're making more money than you can believe. I keep getting this email. Vote the bastards out. Everybody. All of them. Let God sort them out. Shoot them all. Vote-wise. Take them all out of the Congress, throw them out and make them get a job. Or make a decent living somehow trying to work. Most of them don't know how to work, I know, because they've been in the Congress too long. But in the meantime, start fresh. and let these new people know that if they screw up the same way, they're out tomorrow, just like the last batch. And they could turn over the entire House this year coming up, right? And a third of the Senate, and then dump the other 2/3 in the following 2 years. What do you think, Rudy?
Well, it's probably not going to happen. I think the re-election rate for incumbents in this country is it's well over 90%. I'm pretty sure.
They got the whole system by the you-know-what, the gonads, as they say.
Yeah. It's going on locally, too, so.
Right. I understand it's almost impossible to run for office without official sanction in New York State. They've got so many rules and regulations and laws and so forth, you can't even get on the ballot. Of course, nobody gets on the ballot unless they have $1 million anyway.
Well, I don't know about locally, but
I mean, at least on the state and national.
Yeah. Geez.
Yeah.
You need
zillions, big money, and all your own money. Look at that Bloomberg. What do you spend to get a mayor, become mayor the first time? He's a billionaire. What's he care? All right, Rudy Mueller. Dr. Mueller is a prominent physician in Chautauqua County, and he is also, very rare, a member of our county legislature. He gives up his time, and a lot of valuable time, to serve the public of Chautauqua County. And basically it's uncompensated, as most of the legislators know. Somehow they think that all the county legislators make $100,000 a year, but that's not true.
Well, we get compensated.
Very minor compensation.
It's $9,000 a year, and we did get rid of the health insurance last year.
That was as much as $9,000, probably.
It was probably more, actually.
Yeah, more.
It could be up to a $13,000 a year benefit.
Yeah.
So,
so you took a pay cut of more than half, huh?
Well, not all the legislators took the health insurance, but it did save. It probably saved the county around a couple $100,000 a year, which is a good thing.
It's a good thing. It's Martha Stewart used to say from the Slammer.
We're trying to downsize, or some of the legislature are trying to downsize the legislature too. There is some money savings, and that's some of it.
I talked to Fred Crosscut. He says, "No, you're not saving any money. It's peanuts."
But to me, it's more symbolic to try to right-size our government to try to consolidate. I mean, we have about 130,000 people. We'll see what the new census says. And we have 25 legislators. Erie County has 15. I think they're going down to 11. They just voted to knock that down to 11. We have 28 towns, 15 villages, 2 cities, all with their own local governments. I mean, if you started from scratch, I don't think you would do that. Oh yeah, I forgot the 18 school districts, and then we have Department of Public Works supervisors, probably another 40 of those. So, we have this massive bureaucracy, and Stan Lundeen did headed up a commission to look at, why are our taxes so high? Could we make local governments more efficient? Could we consolidate? Is there room for efficiency? And I think downsizing the legislature sends a message that we're serious about that. It would save some money, maybe about $60,000 a year, but more importantly, we're trying to consolidate. We're trying to make the government smaller, more efficient. I also think the legislature will be more effective with 15 or 19 legislators. We could consolidate the committees, or you could serve on more committees. You'll know more of the information. Right now, only 6 out of 25 legislators serve on 2 committees. If we went down to 19, you basically would, if we didn't consolidate the committees, we would have 2/3 of the legislators who would be on 2 committees. So twice as, you'll be intimate about twice as much of what's going on. You can read the minutes from the other committees, but you can't ask questions. So you'll be a better informed legislature. The other thing that we would do is we'd have more competitive elections. In the last election, I think 11 out of the 25 had no opponents.
It's a rotten job. Who wants it?
Talk about incumbents.
The power, right?
So if we downsize, we consolidate, shrink the legislature.